Prevention of kidney stones is a multifold strategy. Basically, those patients who are having recurrent stones on both sides, coming repeatedly with colics, they have to undergo a detailed metabolic evaluation where we test the blood as well as a 24-hour urine analysis to find out what exactly is the cause. And we also do stone analysis wherever we have retrieved these stones. And on the basis of this, we put the patient on specific treatment, like if it's oxaluria or high uric acid or phosphate stones or infected stones. Each type of stone has a different treatment modality, which are usually oral medications. But those who do not have any of these metabolic problems on evaluation, then the general instruction is mainly to have good fluid intake, which is usually about 12 glasses a day.
Right.
In hot and humid season, it has to go up to 14 to 15 glasses. Around 2.5 to 3 liters a day would be the ideal water intake. In terms of diet, as I had mentioned earlier, shellfish, prawns, red meats are the main non-vegetarian culprits, and too much of tomatoes, brinjal, ladyfinger, uh, too much of milk products or nuts are also harmful. So alcohol is also in large quantities. They have very high oxalate content and uric acid content, so would have to restrict on that.